My name is Frank Pomposelli. I'm the chairman of surgery at St. Elizabeth's Medical Center. I've been practicing vascular surgery in Boston since 1987 when I got out of my training. My expertise has been in the area of circulatory impairments in the lower extremity, complex bypasses. I also perform complex open and endovascular aneurysm repair, carotid endarterectomy, treatment of blockages in the carotid arteries in the neck, and have a special interest in redo operations that have failed and need to be redone. That's been an area of interest and expertise of mine for many years. The shift in the treatment paradigm for vascular disease changed about 10 to 12 years ago, and now many of the procedures that we used to do by conventional open surgery are now done minimally invasively. So where before people would have bypass operations in their leg, they now can have angioplasty and stenting. Aneurysm operations, which used to require large incisions, significant blood loss, long hospitalizations, and long periods of recovery, are now done with stents delivered through femoral punctures in the groin with no incisions whatsoever. Most patients go home the next day or the day thereafter and are fully recovered in 2 or 3 weeks with very little pain or discomfort during the recovery process. Even varicose vein surgery has been dramatically changed. For many years, we performed conventional surgical stripping and ligation, an operation that patients who've had, many say, would never have again. And now these procedures are done by a procedure called radiofrequency ablation, which again involves a puncture in the leg just below the knee under local anesthesia. It's done in the office in about a half hour or so, and patients go home immediately after with very little discomfort and no need for recovery. So like most other areas of surgery, vascular surgery has become largely minimally invasive. But the good news is myself and my colleagues also still perform the gamut of open operations, which are still occasionally needed. And as always been the tradition in vascular surgery, we manage many vascular patients without any surgical procedures at all. The medical management of vascular disease has and remains in the purview of vascular surgeons. The comfort and care of patients has always been paramount at St. Elizabeth's. I think what makes St. Elizabeth's Medical Center unique is that we have some of the best surgeons performing the most complex cases in a relatively small environment. So I like to say that you can get high-powered care in a low-powered environment.